It's been over a year since the COVID-19 coronavirus emerged in China and set off a devastating global pandemic. As the death toll has grown, the responses of governments and health services have come under intense scrutiny. Much less attention has been paid to deeply disturbing questions about the largest group of those afflicted, the disabled. In the first of a 2-episode special report, we've been to investigate whether enough has been done to protect the world's most vulnerable people.
As governments and states across the world continue to battle the COVID-19 pandemic, a deeply disturbing question. Has there been a shameful failure to protect some of the world's most vulnerable citizens? People with disabilities, 1 billion of the world's population.
It felt like we as disabled people were just invisible from the story.
We've been investigating allegations that people may have been denied potentially life-saving treatments simply because they're disabled.
You know, it's almost a eugenic decision. It's somehow saying that other people's right to life is more important than ours.
And examining claims that the COVID-related mortality rate amongst people with disabilities is shockingly and disproportionately high.
The majority of people that have died during the pandemic have been persons with disabilities or persons with chronic diseases. It is outrageous.
As the pandemic spread throughout 2020, we set off with careful precautions on a journey across Europe to investigate the dangers faced by disabled people. Dangers highlighted by the UN High Commissioner for Human Rights, Michelle Bachelet, in an exclusive interview.
We know that people living with disabilities, usually they had already unequal conditions and they are discriminated, and that makes them more likely to be exposed to the virus and less likely to be treated. As you know, in many countries, the biggest amount of people who have died of COVID-19 is people living with disabilities.
Michelle Bachelet was not alone in her concerns. Across the world, disabled people and their supporters were trying to raise the alarm. In April 2020, 4 leading international NGOs wrote to the World Health Organization asking them urgently to collect accurate data on just how many people with disabilities were dying of COVID. In October 2020, I spoke to Dr. Larkos Sietha of the WHO. What data has the WHO collected about the numbers of disabled people infected by COVID and the numbers of deaths of people with disabilities due to COVID?
Yeah, this data is not available to us at this point.
Why not? Why not?
Because it is not reported, but it is also because it is not collected. We would welcome very much if countries come forward and provide this data.
The World Health Organization later said that after reviewing sources from around 30 countries, they were confident in claiming that
people with disabilities constitute a very large proportion of COVID-related deaths.
At this leading London university, academics began an international study of COVID deaths in care homes for the elderly and disabled across Europe.
It was an enormous shock. I mean, when we did the very first report, I never expected to find that it was 40 to 50% of all deaths that were people in care homes, especially given what a small share of the population they are.
We know that persons with disabilities have higher risk of some long-term health problems, and those are health problems that put them at greater risk of getting COVID and then having bad consequences. We know that people living in group settings, in congregate settings, at higher risk of getting infection. So that puts people with disabilities doubly in jeopardy, if you like. And a third problem is that often persons with disabilities have difficulty accessing healthcare.
And so that it will be a disproportionate number of people with disabilities who've been dying from COVID from the research that you've been doing.
Yes. The LSE findings begged a serious question. Were disabled people getting the support they needed? One measure would be the mortality rate amongst disabled people. Here in the UK, disabled activists, campaigners and lawyers were fighting to get official data on the numbers of people with learning disabilities who were dying of COVID-19. Simone Aspis, an advocate who has a learning disability, told us how she joined a court case to force the UK government to release official figures on the deaths of people with learning disabilities.
I think for me, it's about the value that we put on people's lives. A number of us underneath the Every Death Counts campaign ran a campaign to highlight the fact the government were not publishing data, releasing data around the deaths of people with learning difficulties from COVID-19.
Under growing pressure, official bodies in the UK did begin to produce statistics, and they were truly alarming. In November 2020, they showed that people with learning disabilities had a death rate from COVID up to 6 times greater than that experienced by the general population. And in the 18 to 34 age group, the death rate was 30 times higher. While official figures for England and Wales showed that between March and July 2020,
disabled people made up almost 6 in 10, or 59%, of all deaths involving COVID-19.
It was a mortality rate that suggested disabled people in the UK were not getting anything like the support and protection they needed.
It's utterly shocking, especially as the government knew from the very, very beginning that disabled people, particularly those that were extremely clinically vulnerable, those in care homes, those using social care, would be, vulnerable to coronavirus.
So what was happening outside the UK? Despairing of the failure by international authorities and governments to gather accurate data, the NGOs who'd asked the WHO to gather information set up their own global survey. It was a hugely ambitious study, spread across 134 countries in 25 languages and incorporating over 3,000 testimonies, the majority from disabled people and their organisations. The findings were devastating across the world and
egregious failure to protect the lives of people in residential institutions. A dramatic breakdown in essential services in the community.
And that,
in some cases, persons with disabilities were directly denied access to treatment for COVID-19 because of their disability.
Stephen Allen's NGO Validity helped set up the global report.
It confirmed one of our big fears, which is that the human rights of people with disabilities were not being, in fact, directly addressed or prioritised in the response to the pandemic. I think it is a serious neglect by states towards some of their citizens who have the greatest vulnerability.
These findings suggested that far from getting the extra support they needed, many disabled people were actually getting less support than they'd had before the pandemic. As the world began to wake up to the threat to elderly people in care homes, the disabled in some institutions across Europe were being abandoned.
We have more than 1 million of Europeans with disabilities living in institutions. So institutions are the places that people become forgotten, neglected.
This Brussels-based organisation represents service providers across Europe.
We picked up some messages from the field that in certain care sectors and care homes, people were for days without having diapers changed, days before having decent meals again on their table. And that, of course, is very shocking.
Spain was one of the first countries to go into COVID lockdown. And here too, the disabled and their carers told us they were being abandoned by the authorities. And as in so many countries, the first crisis was over a lack of personal protective equipment.
I clar, nosaltres vam començar molt al principi, estem parlant de principis de març. Llavors, clar, ningú portava mascareta, no s'utilitzava el gel hidroalcohòlic, no hi havia massa informació sobre la malaltia.
At this day centre in Catalonia, for people with intellectual disabilities, carers were in despair.
El que s'estava complicant molt, a una sensació de caos i ens vam haver d'organitzar com molt ràpidament.
In the UK too, PPE was in short supply. The manager of this small care home went to extraordinary efforts to procure a supply of PPE to protect his residents. The problem was that the UK's National Health Service, the NHS, was also desperately short of PPE.
I was speaking to managers saying that they'd had phone calls and they'd had to give their PPE to the NHS, and that worried me that that was going to come to us when we'd worked so hard to kind of get a stockpile of it.
It was heartbreaking, you know, where we knew the solutions, government knew the solutions, the distributor networks weren't properly in place, people didn't have the right protection. You know, that's the long and the short of it.
Everyone agreed that at the heart of any serious effort to protect the vulnerable had to be a rigorous programme of testing. In the UK, the government was quick to promise just that.
All care home residents and staff in England, both those with symptoms and those without, are now being tested.
But for disabled people, the reality turned out to be very different.
I then had to phone families and say, well, actually, what you've just seen on the 6 o'clock news is complete rubbish because it's not happening.
What sort of reaction did you have from families when you told them what the real situation was?
I think disbelief, I think disgust, and I think, you know, a lack of, or a sense that, you know, their loved ones were being let down by the government.
In care homes across the UK, like this one in Hertfordshire, management were desperate to protect residents, but tests were in such short supply that their use had to be restricted.
In August, we had 700 tests in stock, which might, of course, seem like a lot. However, we have over 600 staff and nearly 200 clients, and therefore weekly testing, that just wasn't going to be enough. That was a time of great concern.
Although the centre did eventually get enough tests, the uncertainty and lockdown had taken a huge emotional toll. 44-year-old Caroline Baston has lived here for 14 years.
I've missed my parents an awful lot.
What do you think about COVID? Does it make you worried? Or
yes.
What worries you about it?
Because it kills an awful lot of people.
But on top of concerns about tests for the most vulnerable, during this investigation, we were to hear more highly disturbing allegations about disabled people's access to critical life-saving care. This is Doreen Chappell. In 2000, Doreen was diagnosed with a neurological condition which affected her muscle coordination. When the pandemic began, she was living with her husband John in supported accommodation. Doreen was admitted to hospital in April 2020 after developing a cough and a high temperature and tested positive for COVID. It's not known how she contracted the virus, but her condition worsened and she was given increasing levels of oxygen.
I said to the doctor, can you not put her into intensive care so that she gets the proper care she needs? And we were told that she just wasn't suitable.
What did you think about that?
We were disgusted with that. You know, it was very, very upsetting. And we are left feeling, no one's asked us about this. No one has said, you know, no one's rung us up and explained, this is the situation, this is what we can give, we've tried this, therefore we recommend that she goes on end-of-life care. There's none of that. My mum wouldn't have not have approved going on end-of-life care. We certainly didn't approve going on end-of-life care. It was just done.
Doreen died without her family by her side on the 13th of April, and her grieving family are left with one haunting question. If Doreen hadn't been disabled, would her care have been different?
We felt that it was almost as if they didn't really want to know. All they needed to know, she was a disabled woman with COVID-19. That means she was a dead woman.
Warwick Hospital, who treated Doreen, told us,
"We take any decisions on resuscitation and the escalation of treatment very seriously."
And they added,
"We do not discriminate and only base decisions on medical grounds. And when patients are unable to tell us their wishes, we carefully consider their best interests."
In Spain, we heard about the treatment of another disabled woman, Montse de la Mora. At 54, Montse had a developmental disability and was suffering from glaucoma. Her sister Clara remembers her as outgoing, keen on family activities.
Li agradava fer de tot. L'única limitació era el que tu amb ella poguessis fer, res més. Si li deies de poder fer un passeig per la muntanya, la piscina, li encantava nedar al mar, li encantava estar amb els animals, que li agradava fer de tot, tot el que està sobretot en família també. Es deleia per les festes que fèiem tots junts. La Montse era una noia... Un segon.
Montse was admitted to hospital in March 2020 with COVID symptoms. The family spoke to a doctor on the phone who said she was not a candidate for intensive care.
El retras. Primer va al·legar el retras mental i a més perquè era una persona dependent i que aleshores, dependent en diversos sentits i a més tenia glaucoma. Aquests van ser els motius pels quals ella no va entrar a la UCI.
Montse died on March the 26th, 2020.
Aquí hi ha hagut un cas claríssim de discriminació en funció de les discapacitats intel·lectuals i de la dependència de la meva germana. Això no pot quedar de manera impune.
We invited the Badalona Hospital, which treated Montse, to comment. At the time of recording, they'd not done so. But disabled activists in Spain were particularly angered when they discovered this document. It outlined a triage process, which campaigners suggested meant COVID victims with disabilities might be pushed down the queue for intensive care, behind those without disabilities, or even denied care altogether.
Aquest document el que mostra és una absència total de coneixement de la discapacitat. I amb una aplicació d'aquest document sense tindre aquesta dimensió, podia implicar que una persona no fos atesa pel sol fet que té una discapacitat.
Similar documents were emerging in other countries, including the UK, where medical staff were given something called a clinical frailty scale to determine if patients were too frail to receive life-saving intensive care treatment when suffering from COVID. This document was later disowned by the country's health service. But when a leading UK advisory body, the National Institute of Health and Care Excellence, known as NICE, published their guidance at the start of the pandemic, they again mentioned using a clinical frailty tool to score patients.
One of the most shocking things, I think, was quite early on when the National Institute of Health and Care Excellence issued guidance on who should receive critical care and linked it to something called the frailty scale, which basically said if you needed support to live at home, you should get more points and therefore be deprioritised for care, now critical care.
Disability activists were furious with the suggestion that people with stable long-term conditions like learning disabilities, autism and cerebral palsy might be scored too frail to get life-saving treatment. Doug Pawley, who lives in a home in Wetherby in the UK, has a neurological condition which limits his hearing and mobility.
I found the NICE guidelines incredibly offensive, but also utterly unsurprising. We have a wide history of disabled people's rights being considered a luxury at best.
The World Health Organization said they'd received international reports of disabled people being denied healthcare because of triaging policies. They said that although they'd produced an ethical framework for such decisions, they had not collected triage data country by country. Back in the UK, the advice from NICE confirmed the worst fears of many disabled people.
This was at the time when a lot of us thought we might end up in hospital, and it left people feeling very uncomfortable and unsafe.
In response to vocal objections, NICE amended their guidance, saying the system shouldn't be used to assess certain groups, including those with learning disabilities or stable long-term disabilities such as cerebral palsy.
If we think back to March, the pressures were huge, weren't they? The pressures were huge, and we needed to put things out to help the system very quickly. I am really sorry if it caused people any fear or any of that concern or heartache, because that really wasn't the aim of the guideline at all. And hindsight is a wonderful thing. It's fair comment that we added some added clarity.
What's happening in terms of triage? What do we know? Are people with disabilities being discriminated against in terms of life-saving care? What is known about that? What does NICE know about that?
We aren't aware that there is any active discrimination going on.
But across Europe, disabled activists remain far from convinced that discrimination against disabled victims of COVID has ended. And for some, this raises uncomfortable associations.
That was the idea in the past, and that idea ran through our past Second World War history, let's say, until today. And the triage discussion showed us it's not over. We, people with disabilities or pre-diseases, were super concerned. So who get medical help and who not?
At the UN, Michelle Bachelet, herself a physician and former health minister, was equally appalled at the triage discussion.
It's a terrible thing because people with disability have the same rights and should have the same rights as as a person without disability.
In part 2 of this investigation, we examine allegations that under the cover of COVID, disabled people are suffering systematic abuse and neglect in some institutions across the world.
We had reports for restraining practices returning back in institutions.
We reveal how during the pandemic, do not resuscitate notices have been attached to the care plans of some disabled people without their agreement or the approval of their carers.
If doctors are putting do not resuscitate notices into a whole number of people with learning difficulties, medical notes, right? Then what is it? You know, what is it if it's not eugenics?
And as governments begin to roll out COVID vaccination programs, alarm that disabled people may be pushed down the list for treatment.
It's disgusting. They were last on the list for testing. They're now last, or bottom of the list for the vaccine.
And from around the world, fears that the worst may be yet to come.
We've lost many of the successes of recent decades, and that's because governments, even prior to the pandemic, did not prioritise and genuinely commit to improving the lives of people with disabilities.